Namaste, everyone. Welcome to the Cārvāka podcast. This is your host, Kushalmehra, welcoming you to another interesting chat today. Today's subject is on depression. What is depression? What are the different facets of it? Uh, what do we know about it? How do we unpack it? So, I've been actually, if you guys remember in my last monologue, somebody in the live stream in the monologue, I think it was Srishti Kaul, if I remember her name correctly. She had suggested to me, Kushal, you need to do a discussion on how COVID, this entire pandemic, is actually having an adverse effect on mental health, and nobody's talking about it. And I was like, you know what? I actually have a friend who's a doctor and who's a trained psychiatrist. I was like, what the hell? I should actually talk about it. So I'll just tell you a bit about my guest today. So my guest today is Dr. Nayanika Barat. She is a practicing psychiatrist. She did her DPM in India and later followed it up with a fellowship in Australia. So without further ado, Nayanika, welcome to the Cārvāka podcast.
Hi, Kushal. Thanks for having me.
So, Nayanika, let's start first with actually defining depression clinically, because there seems to be a lot of terminological confusion. So I'll just explain my question. I'll unpack it a
Mm-hmm.
little more. So what
Mm-hmm.
happens is, where you hear this word "I'm depressed" being dropped a lot. A lot
Mm-hmm.
of times you'll hear just casual conversations. Ki somebody will come and tell, "Oh, yeah, I'm feeling very depressed. I feel very
Mm-hmm.
depressed." But you, as a doctor and as a trained psychiatrist, for y'all, depression means a very specific thing. So could you start by actually explaining to everybody over here, what do you guys mean at your level, at a clinical level, when you diagnose someone as being depressed?
I think that's a really good point you make, that a lot of people say that they're depressed, and what they actually mean is they're sad. They're sad about something that's happened in their lives. Maybe they've missed a bus and they say that they're depressed. That kind of thing happens. From a clinical point of view, we only diagnose people with, with depression using certain criteria, and it depends. I mean, there are two main kinds of classifications. One is by the WHO. I know it's in everybody's bad books at the moment, but anyway, it exists, and they have the ICD, the International Classification of Diseases, and that actually exists for everything. It's used worldwide for billing and diagnosis and everything. And the other one is by the American Psychiatric Association, and that's called the DSM, or the Diagnostic and Statistical Manual. So so both of those overlap to a large extent on how they diagnose depression. And what both of them say is that you have to have a low mood, and for children, you might have an irritable mood. And that's kind of important because often with kids, it's quite rare to see kids saying that they're sad. They're more likely to snap at their parents, snap at friends, even teenagers. And the other thing is a lack of joy. And then there's a number of other things, like there's a loss of appetite or weight. There's problems sleeping. Um, there's problems with your thoughts either going too fast or too slow. Uh, Sometimes when people are extremely depressed, you can tell even by the way they walk, because they're walking really slowly and moving really slowly, and they have thoughts of guilt. Often they think they've done something really awful when they haven't done anything. Thoughts of guilt. They have problems making up their minds. You have people who can't get going in the morning because they can't decide whether to wear a red shirt or a blue shirt. That's too hard for them. And 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 feeling. And one thing that's really common is tiredness, thoughts, uh, tiredness or fatigue. Um, the one that's really important here, because I think it's how we've started to talk about it. It's thoughts of death and suicide, and it might be, and it might be plans, and it might not be plans, but thoughts of death or suicide almost every day. All these symptoms have to be there almost every day, and it has to go on for a period of at least 2 weeks. So it's not like I think all of us have had that an exam has gone bad and you're upset for a couple of days, and then you watch a film, you can have a joke, and you're good. But this is something quite different, and that's what is diagnosed. That's what is called major depression, and there are other kinds. Like a lot of the people I think on social media who talk about being depressed all the time have something else that's called dysthymia, or the new term for it is a persistent depression, and that really means that people are depressed, have they're not as depressed as they would be. They don't have all these symptoms, but they have some of these symptoms, and it goes on for at least two years or 1 year if it's a child. And a lot of these people, it's basically a depressed mood, and tiredness, and loss of enthusiasm. But a lot of these people can actually function reasonably well. The significant thing with a major depression is that it really has to impact your functioning from day to day. It's most people who say that they're depressed, if they're still going to work, still coping, then obviously they're not really they're not really depressed. They're going through a hard time, but they're managing. Um, and there are other things, and there are other kinds of depression. Like, for instance, in women, there's a dysphoric disorder. It's called PMDD, or premenstrual dysphoric uh, disorder. It's 2 weeks ahead of their periods, and the treatment for that is completely different. And there are other kinds of depression, like there's a bipolar depression in people that have a bipolar disorder. There's depression that comes as a result of certain illnesses, medical illnesses. Often, I think when people are talking about depression, they're talking about an adjustment disorder with a depressed mood. That's when something bad has happened, and it stays for a little while, and that can stay with you for a couple of weeks. And if there's a reason for you to be upset or depressed, you wouldn't call that a major depression straight away. So that's what they used to call a situational crisis, or a situational depression. And so that's what really makes a depression. It's not really just being sad or having one bad day. It, it's a lot more than that.
So I had a follow up for this. So how much of a role does so I have always found this every time I try to raise this question to anybody, and I come from a point of curiosity, not surety. So even now when I'm asking you this question, it comes from a point of curiosity, not surety, that how much of our inherent genetic makeup. So a life, as we know, is a mixture of nature and nurture. It's not just nature, so because then we would be committing the naturalistic fallacy. But the point is, how much of your inner genetic makeup also have a very important role in actually kind of figuring out whether we are depressed. Are there any studies that are done that actually try and find out what kind of a genome plays a role when it comes to depression and stuff like that?
Yeah. So I mean, as you know, everybody who studies health loves identical twin studies, and most identical twin studies show that the concordance, that means that if one twin has a diagnosis of depression, there's above 50% chance that the other twin will. I think most studies show 50 to 60. Um, That differs from study to study. I've seen some that actually say 80 to 90, but I think that would be quite unusual. We don't get the kind of studies that we used to earlier because things have changed, where you would have twins that were brought up in different homes, and then those were still about 50 to those were still around 50 twins brought up together around the 60 or 70 mark easily. So, so you're right. I think it's not only your genes. It really has to be a perfect storm of events that make it happen, and that's the case for a lot of mental illness.
All right, so now let us get into COVID specifically. So actually, I was having this thought a while ago that I was watching. Don't ask me why. I just watched these jail documentaries about gangs and the worst gangs in jail. Yes, guilty. I like that kind of stuff. But so the one thing I found very interesting when I was observing all these, these are hardened criminals like sociopaths who've committed murders and stuff like that, and brutal, gruesome crimes. They are not scared of a 7-foot man who might have 20-inch biceps who could crush them literally. They're not scared of that. But what they're scared of was something very weird. And I mean, I found it so shocking when I saw it. I remember watching it and I was like, wow, this man is not scared of that 7-foot monster who has killed everyone, and he's willing to share that little walk ground in the jail with that. But the one thing they're scared of, every one of them, is solitary confinement. Now let me kind of extend it to what the situation is with the lockdown and COVID, and the sporadic effects that are kind of doing. And obviously I want you to talk more about it. Is what do you think are the reasons? So what is it that triggers this primate brain so much that the most hardened of criminals actually are so scared of solitary confinement? And do you think that is also one of the reasons that our primate brain is really having so many problems in the current lockdown scenario, where we are kind of stuck at home? Especially, think about the scenario. You live in Mumbai. Most of us live in apartments or small apartments, 1 bedroom, 2 bedroom apartments. And do you know how it is in Mumbai, right? Or to make our lives worse, we put box grills. Now it's not allowed, but in all the old, as if it was not enough to have windows. I was like, nahi, main tumhe jail mein dalunga, box grill bhi lagao andar. And we have these box grills, so you're literally living in a jail. That's like a jail. So can you unpack for all of us, what is it that solitary confinement scares the shit out of us?
So I think there are a couple of things you've raised here, but I'm going to go with talking about solitary confinement. You probably know more about this than I do, but I'm pretty sure that solitary confinement is a length of solitary confinement if it's done to an enemy soldier is a war crime. I think, as far as I remember, it can't be done beyond a certain amount of time. And 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 for instance, even in jails, even in psychiatric hospitals, there has to be a really good reason. Like, for instance, where I work, ideally, if somebody is really agitated and they have to be calmed down in a low stimulus environment, they're not supposed to be on their own for more than about three hours, if possible. And and you're right. The reason is that we've evolved to be sociable after a certain amount of time. If there's sensory deprivation, even people who've never had a mental illness start to hear things, start to see things. Um, our mind starts to play tricks on us. So yes, I do think that's part of it, but I don't think that's the only reason that this has happened with COVID. It's because, I mean, there are so many things that have happened here with with COVID, and the most important one, I think, is the loss of certainty. Like, it's quite hard uh, for us to accept uncertainty and that it exists. And I think really that we have such little control over what happens to our lives, and this is an issue that I have with a lot of self-help books and so on that say try and take control of your life and things like that. And to some extent, it's good, but there's nothing that anybody could have done that would have prepared them or saved them from the situation where they had to be in isolation for COVID. So there are some things that are just not in your control, and that's quite hard for us to realize because from childhood we are brought up, we are trained to act as if everything is under our control, and this uncertainty and not being able to control anything, I think it has affected everybody quite badly. But I mean, there are of course the obvious reasons that people don't have work. Lots of people don't have work. I think in Australia, 6 million people were out of work or lost jobs, and this is a country of 24, 25 million people. So you're talking of um, and and a lot of them had other jobs. So, but because there are a lot of people who work 2 and 3 part-time jobs, but there were still 5 to 6 million people who lost jobs, and several countries worldwide have an unemployment rate at the moment of about 20-30%, and a youth unemployment rate of about 50%. So obviously, with Maslow's hierarchy, there are people who now don't know where the next meal will come from, where the rent will come from. I've actually seen Indian students from fairly, and they look like they're from middle class families in queues for food and rent vouchers in places in Australia, and it must be quite humiliating for them. I imagine because they're obviously from reasonable backgrounds, and lots of people, even ones that aren't Indians, lots of middle class people have had to go and put their hands out across the world for and ask for some help, and there's a certain perceived loss of dignity in this, and that hasn't helped. I think something that people don't really realize though is that a lot of us get some sense of purpose from our work, and not being able to go to work. If I'm so, and I think that's the case, especially for men, even more than women. If I'm not a provider, then who am I? And that's quite hard. So a lack of purpose is something that's really hard to deal with. One book that I recommend to everybody who can read it is Viktor Frankl's Man's Search for Meaning, which I think you've probably read here, and that talks a lot about how what we really need is a purpose in life to keep us going, and a lot of people have lost this. The isolation, of course, if you live on your own, that might be a problem. But even if you don't live on your own, people have been cooped up in these 3 or 4 people bubbles, and and people who are married, for instance, couples and families, they are not used to spending 24/7, in one room, in one place all the time, especially as you mentioned in Mumbai. It's a different thing, say, in the country where houses are larger and you might sit in 2 different rooms. But in Mumbai, most people are probably sitting and talking to each other continuously 24/7. And I think that's not meant to happen. That's just not how marriage has evolved over the centuries. Nobody is meant to spend 24/7 with each other. And so I think that's caused issues. And of course, having to teach children and having to deal with them, and then having to deal with their not being able to go out, their not being able to play. So all of that has added up. And then you look at just the everyday problems, like people who were already unwell, cancer treatment, broken legs, all kinds of pain and suffering that are even harder to get help for because of this, basically. Yeah.
So here's my follow up then. Now, what I've found something. Okay, we kind of get it that we're stuck in this. We have no option. We try to find meaning in our lives on a constant basis, and I like the idea that you mentioned Viktor Frankl, because I would highly recommend everybody to read that book. I think it was two books, like Man's Search for Meaning, and then again he wrote Man's Search for the Ultimate Meaning, although I think even two paragraphs were hardly different in the first book and the second book. But ठीक है, मैंने दोनों ले लिए और पैसे वेस्ट कर दिए. But I don't know why I bought the second one. But yeah, it's a must read book. But here's my question now, and it's related to the first question where we kind of defined what depression is specifically. But what I see right now, and I want to ask you before I get into this one, actually, and this is so true because I've seen this with my grandparents. My nani or my dadi, she would not have a lot of issues as she kept on getting older. They were kind of used to the idea of staying at the house or staying a larger amount of time at the house, because as and when you get old, your physical abilities drop off, and your ability to go out kind of reduces, right? You can't walk so much, various physical reasons. And I clearly remember that, the one person who had the most problems, I clearly remember in my own life, is my nana. My nana was an army man, always in charge. Everybody is in order. I'll fix the fan, I'll fix the bathroom, I'll fix the lock, I'll fix everything. And then that thing falls off. Now, I want to relate this to COVID, where, as you said, we're kind of used to, having a routine in life. So is it about the routine being disturbed? Then okay, and we all know it's a temporary change in routine, because whether we like it or not, we are entering the phase of social Darwinism now, where basically people are going to go out no matter what. So people are going to go out, but while the ones who are staying at home, so what could be the tangible tips, according to you, in your opinion, that we could practice? What are specific tools? Are there some mental exercises? Are there some physical exercises? Are there certain tools that we can use while we're living and we are stuck in these cages in our houses in Mumbai or other parts of India? What do you recommend we do while we are stuck in this quagmire?
I think to a large extent, people are doing a lot of that. You know, they're not losing touch, and that's one reason why the initial expression was social distancing, and then they changed that to physical distancing, because when we're only trying to put a physical distance in between us and other people and not lose touch with other people. So it's really important to stay in touch with other people. Um, it's it's important to try and find meaning in other things, and it's something to think about longer term, that none of us is going to work forever. I mean, hopefully not. We're all going to retire at some point, and one thing that people often face when they retire is that they've put their entire identity and time in their jobs, and there isn't anything left for them. There's nothing, and they sit at home. And as you mentioned, your nana, he couldn't deal with being at home and having a disability and not being in charge. So I think it's something to think about, that we need to get some other interests that have some meaning. And everybody isn't going to sing, everybody isn't going to cook, but some people are going to be able to take up an exercise routine. Some people are going to be able to read. um, I think what's been making it so hard for everybody, as I said earlier, is a lack of certainty. Like you're saying, it's a phase of social Darwinism, but it might not. I mean, it's happening now, but you don't know at what point there's going to be another lockdown, and most experts think that there are going to be several lifting of the lockdowns and lockdowns over and over until there's a vaccine, or until everybody's immune, which I hoped hasn't happened, because it would mean that millions of people will die in the meantime. Uh, so, so to keep in touch with people, to stay physically active, to stay mentally active, as you said, to read. I mean, it's really tempting, I think, to spend all day, every day in bed and not do anything. But that is bound to depress you, because um, it's really important to schedule activity and and do some things that give you some kind of happiness. And for some people, that might be reading or films. And happiness and meaning are the two main things. So it's not just hedonism. You have to do something that makes you feel like like your life is worth something. It's important to other people as well.
All right. So I want to ask you. Obviously, the natural follow up was you just mentioned about what you eat. We have to watch out what we eat, and I think that is something, especially when it comes to mental health, is actually ignored a lot. Your diet. Now, I'm not the expert here, but I try to read up as much as I can, and I try to stay honest as much as I can. And again, I'm not talking about from the Western dietary point of view, because primarily our audiences are Indian, even though Indians living outside India. So I mean, the Indian food or the Indian dietary, matrix is kind of specific about ABC. Although I think Ayurveda has some very interesting things about how your diet should be very much in sync with your inner nature, and it talks about those things. And no, I don't think that aspect of Ayurveda is booga booga. Although homeopathy is booga booga, that's a different thing. But my question to you is, what do you think? How much of a role does diet actually play when it comes to depression? And I'll give you an example. Like, the most natural thing we do when we kind of feel down, we just go to the worst food food option on planet Earth. It's not like if I'm feeling depressed, I'm going and picking up a broccoli, eating broccoli. The one thing I'm going to pick up is going to be potato chips, and I'm going to gorge on those potato chips and sit and eat till I go down to the blaze of glory. So what do you think are the reasons, and how much of a role diet plays?
I don't actually think that diet is a primary role for people to have depression, but I think if other things are happening and people don't eat well, I think it could possibly trigger an episode where you might have been able to avoid one. And the studies, and as you might have guessed, there haven't been a lot of studies on this, because who's interested in funding a study on diet? I don't think there's any money in it to be made for anyone. It's not a drug. So there have been a couple of studies, and there are some centers which work mainly on diet in Europe and the US. And the main ones say that a Mediterranean diet is the way to go. So that's healthy fats like avocado and olive and things like that. There really aren't a lot of those in an Indian diet. The other one is a low sugar diet, and it's important to make the distinction that it's a low sugar diet, and not necessarily a low carb diet, because a very low carbohydrate diet, um, some studies say that can make a bout of depression worse as well, because carbohydrates are needed to manufacture some uh, of the neurotransmitters in the brain, uh, and without that, there won't be enough of that. There are other people, obviously, and there are a lot of ideas on the internet about depression being about inflammation, and therefore going for low inflammation foods. But I have to say, that's that's fine. I think if you're getting your nutrients, I don't have an issue with that. But there isn't any evidence for that. So if people want to do that, I wouldn't stop them. But the only things that there is any evidence for is cutting down on sugar and having healthy fats and complex carbs and enough protein and good fats.
Before I take the questions from the people who are watching it live, I actually did want to ask you one last question, which was about medication. There's a lot of confusion when it comes to medication. So some people, so I'll give you two scenarios, especially. So my reference point is Johan Hari's two books on depression and addiction, drug addiction and stuff like that. So Johan Hari kind of painted a picture in his book where, in his opinion, Western society is actually, if not anything, over medicated. They're not under medicated. They're far too medicated, and most of the medication is under the diagnosis of a person being either clinically depressed or there are obviously other categories. Now, in my opinion, the case on the other hand in India is the complete opposite. In India, we have a lot of societal taboos when it comes to the whole subject of depression itself. The subject of depression being that we don't take depression as a serious problem. When somebody says "Are mujhe problem ho rahi hai," that person would be like, "Are ye to pagal hai." This is the kind of attitude, these are the kinds of answers we get in India all the time, which is actually quite abhorrent if you ask me. So how does one draw the balance from the American over medication to the total negationism and denialism in India? So how does one draw the balance?
Okay, I have to say that I don't think I agree with Johan Hari's book. I didn't buy it because I read extracts of it, and obviously I didn't agree with that. I'm glad that whatever he did worked for him, but I think most people who are severely depressed or even moderately depressed will need medication. And I think there's still issues around talking about that. Like even now, for instance, on social media, people are happy to talk about needing psychotherapy. They're not so comfortable talking about needing medication, but it's really important. And I think you do have a point that there is quite a bit of over medication, and there have been a few studies that say that when 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 other people have looked at patients on an antidepressant, when other clinicians have looked at them and done a checklist to see if they are depressed, the percentage was actually quite low. So so I think it is possible that there are a lot of people who are getting an antidepressant thrown at them because there isn't nobody has the time because of the way the medical system is structured to sit and talk to them for some time and find out what the issues are. But I think even in the US, there are quite a few people that are still not getting treatment when they need it. And I think a lot of those are people who are unable to talk about their feelings. And obviously, men are high on that list because of social training that teaches you not to talk about it. Um, I think you're right in India that there is a lot of stigma, and even now, if if you're depressed, then people say things like, I've actually heard people say things like, "Oh, she takes an antidepressant, she's retarded, or she's mad, or pagal hai," and things like that. And and I think there there really isn't anything else that you can do except continue to talk about it, and that isn't just for me to do. It's for everybody who knows about the existence of depression and anxiety to talk to other people about it. It's there aren't enough psychiatrists and psychologists to do this on their own, and this is something that has to be done for society. So I think it's a job that everybody has to educate other people about it.
So let's go further. So I have to ask you this follow up. So what is the current ratio? Let's say every country must be having a certain ratio, right? For per X number of people, we have these many psychiatrists. So how do we perform at that parameter? Do you have any idea for India? Like, are we good? Are we bad? Or we don't even
It's
have a number?
really low. It's really low. I can't remember exactly what the numbers are, but the last time I looked, it was something quite ridiculous. I think it was something like two or three for every 100,000 people, and I remember thinking it can't actually be that little, but it was.
Yeah,
So,
but
and
how?
other countries like I think I remember with the US and Germany are the ones that I remember. They were about 10 or 15 times that.
So why do you think that is the case? I mean, where have we failed to convince at a societal level? Just a side corollary to this. Do you think because India being an overtly if people have a problem with the word religious, although I think it's a perfectly natural word, do you think India being a very religious society that also has a role to play, where kind of religion takes over the mantle of the psychiatry, where faith kinds of takes the whole role? Faith kind of becomes a scaffolding on which you kind of lean on your times of strife. And that's why also we also have this whole thing where we don't take depression seriously.
I think there's some truth in that, but that's the case in India now. But it's historically been the case in the forebears of modern medicine. Their chemists, their astrologers, um, you, these other people who used to look after, who were in charge of Western medicine 500 or 600 years ago. It's not actually all that long, and even now, and you're right that even now in India, people do look at it from a point of view of religion, and I hear people say, and it's regardless of religion, Hindus and Muslims, everybody. If you have a man, you won't be depressed. If you live a dharmic life, you won't be depressed. And I really wish that that was true. But the fact is that there's mention, as you were saying earlier, even in Ayurveda uh, of depression. And the fact is that if you're going to tell me that when the Vedas were written, that people were not living a dharmic lifestyle even then, um, and yet people are and were depressed. So it really has nothing to do with that. But I think the reason that India has a shortage of psychiatrists is that while it may not look like it in Mumbai, there's quite a shortage of doctors overall, and then there's a shortage of psychiatrist training positions as well. So really, if the government wanted to change it, and if it could afford to change it, it would need to have maybe 5 times as many doctors, and and then you might be able to have more psychiatrists. The number of surgeons is also quite low in India. The number of ophthalmologists is low, so psychiatrists aren't particularly low by that standard.
All right. So let me ask you a question. Now, somebody from the live stream had asked. So they had asked how to cope when one goes through continuous judging from people, especially at the workplace. Is there a way one can find if he or she is clinically depressed by themselves?
I think it's actually quite hard to know if you're depressed, because usually this happens so slowly that you can persuade yourself that it's a normal thing, it's happening, it would happen to anybody. And uh, and because it's happening from inside, you don't realize what's happening, and yet it happens. So it's a good idea to talk to somebody you trust and see what they think, if there have been changes. But in general, if you've lost weight without trying, or put on weight without trying, or you're not able to sleep, you're finding it hard to make decisions, you think all the time you've done something wrong, you can't enjoy anything, you probably are depressed.
All right. I actually, somebody has put this comment here, and I have to share this on the screen. And this is a very serious comment, that we have more quacks than psychiatrists, unfortunately. And I'll tell you,
Okay.
and I've seen, yeah, so I have seen this in my own life.
Yeah.
Because we don't have trained psychiatrists in this country, and because we don't even take the damn profession seriously, we don't have
Yeah.
any decent discussions around it. So the space is filled by हर औंगा पौंगा रास्ते में चलने
Mm,
वाला expert. I don't remember who the hell made that comment. I was like, the one market that keeps on producing books year after year is the self-help book. I mean, if the
mhm,
self-help criteria was so nice, I mean, we should have been done by 10 books, but we have
mm,
thousands of books. Apparently, nobody seems to be getting any help, because those
mm,
self-help books, if they work, we would not have these books
mm,
coming after
mm.
again and again and again. But apparently they keep. So what is this? Why can't we trust psychiatrists? What is it that we have this aversion that people? I mean, I can't even say, in my own immediate family, I see people, or my close friends, they go to astrologer when they're feeling down. What kind of a person goes to an astrologer when you're feeling down? I mean, the astrologer will be like, हाँ आपको ये प्रॉब्लम है, आपके ग्रह नक्षत्र के हिसाब से ये होगा, आपको ये कर दो, ये कर दो, ये पूजा कर दो. अगर लाइफ में, if everything in life was so simple, damn, I would be Bill Gates right now. I would just find the perfect astrologer and my
Mm.
life would be good. And why isn't that astrologer Bill Gates right now is something I've never figured out. But can you explain this damn, I don't know how to put it in any other words other than irritating problem, where astrologers also do the job of psychiatrists in India?
I th- I think that's what I think it's the way that Indians tend to attribute reasons to things. That instead of thinking I've become depressed because of this happening, that happening, uh, what they're more likely to think is maybe, and I don't know enough about it, but maybe I have Mars in the wrong house, or the moon is in the wrong house, and I can do it. And uh, and I think it's easier to think about it as being something that you don't need to do anything about. Whereas when you talk about therapy, which is needed, which is actually the first line of treatment for mild depression, which is what most people have, it's actually quite hard work uh, to put in work into changing yourself, and to change the way you think and practice that. And I don't think everybody is ready to do that. It's a lot easier to think it's like magic. I'll do X and Y will happen. And yes, I think it's a lack of scientific thinking as well, unfortunately. I personally have no problems with people going to astrologers or to anybody else they want, as long as they also accept the kind of treatment that they need. Because it's really sad that lots of people go to astrologers and go here and go there, and then they don't actually get the kind of treatment they actually need, and people die like this.
Yeah, and what hurts me the most is that, look, I get it. You need positive affirmation. It's all about
Mm,
sab theek ho
mm,
jayega. Somebody needs to tell you sab theek ho jayega. and you mix the old adage of Hindi, घर की मुर्गी दाल बराबर. So if घर वाला बोलेगा सब ठीक हो जाएगा, they'll be like, यार तू तो 50 साल से बोल रहा है, कुछ ठीक नहीं हो रहा है. तो तू बोलेगा तो मैटर नहीं करता, वो बोलेगा तो मैटर करता है. It's that kind of thing. I think I get it's not gullibility, and it's actually very interesting. I just finished a book by Hugo Mercier, and he actually talks about how we're not that gullible, and how evolution has actually trained our mind to put these things, and we basically tend to question, we tend to trust people who in our head we have given them the mantle of expertise. So astrologers in this case have been given the mantle of expertise that, you know, they kind of have figured their shit out. But one more question, I really like this question by someone on the live chat. It's actually a good question. Anubhav Verma has asked, what is the best way to deal with overwhelming but fleeting bouts of negative emotion? I think this is a very good and very pertinent question. So what do you think? What would you recommend if somebody was to come to you and something like that? I know you can't give the entire clinical answer, but let's
I
say
can't.
a few tips.
And I'd just like to start off by saying that this isn't personal advice tailored to you, all right? But in general, a really good way of starting to deal with overwhelming bouts of negative emotions is I don't know how many of your viewers have heard about mindfulness, and it's I would really recommend that more people looked at it and took it up, because um, it forms the basis of one of the therapies that is really good uh, for dealing with overwhelming bouts of of unhappiness, of misery. So sometimes being able to distract yourself as well is important, and that's an important difference, say, in between depression and these fleeting things. You know, you might be able to um, watch something funny for 5 minutes and distract yourself, but if it's still there, and there's evidence that mindfulness can actually teach you uh, to look at your emotions from the viewpoint of an observer, instead of feeling that you're experiencing the whole thing and suffering that pain. And the other thing, obviously, is that if there's, it goes without saying that if there's something that you can do about it, then actually do it. Solve the problem that's making you unhappy. If there's a problem in your marriage, try and talk to the other person about it. If you don't like your job, try and look for other jobs. Try and do some problem solving around that. Uh, and sometimes that kind of unhappiness is giving you an indicator that there's something you need to act on.
So by mindfulness, you basically you're saying vipassana, right? Vipassana or those kinds of practices.
I haven't studied any vipassana, so I can't really comment on whether it's a, it's the same thing. But say mindfulness. Uh, when I talk about mindfulness, for instance, if somebody is extremely distressed, a very simple thing that I might do is try and 5 things you see, 4 things you can smell, 3 things you can touch, 1 thing you can taste, yeah, 4 things you can hear, things like that. Try and or sometimes it might be 5 things of all your senses. So try and feel everything. So I don't really know if that's the same as Vipassana, because I haven't studied that. So it's
All
about
right.
try and ground yourself in your senses and in your body, and not in these emotions. Because if you think about it, these emotions are not about right here, right now. Try and be in the moment of right here, right now, and you'll be able to distract yourself for long enough to get over that emotion for now.
Yes, so exactly that's what vipassana is. I remember, I forgot the guy who was the person who came up with the word mindfulness. He basically went to a Buddhist monk and took it
Yes, he
uh,
did.
took it from
Yes, he
there.
did.
So and then
Yes,
he
he did.
changed it a little bit here and there. He basically
Yes, he
organized
did.
it a little more. So yeah, so
Mm.
it so because these things about your momentary existence and thoughts are not a continuum. They're basically single point
Mm.
events, and you basically, where the self being the illusion, and when you look at your thoughts when you're meditating and when you
Mm.
are basically observing your thoughts, and you just see thoughts coming by moment to moment and passing by you,
Yes.
and then I kind of can relate to what you're saying. So yeah, it definitely helps, although I'm guilty of stopping practicing
Yes.
meditation now
Yes, and that's
for a while.
one thing that I would recommend as well. That mindfulness meditation, like I suppose uh, it would be the same as Vipassana. Then, as I said, I don't know enough about it, but you're saying it's the same thing, and that's something that there's evidence that it does help in mild anxiety and depression. It's not going to cure a severe bout of depression, but it helps people to deal with day to day issues, dramas.
Fair enough. I think, yeah, even that, and I've heard some reports. I don't know. You should correct me if I'm wrong. Even I think your breathing exercises of a particular kind. I think some sort of yoga, some sort of pranayam, and all those exercises also. What I feel this is any activity where your mind is focused on a particular job, and you kind of you basically are focused and you have a task at hand. It tends you to it kind of distracts you sometimes from all the other things that go on in your life. And maybe that is one of the reasons that people who go armed forces, when they go into combat, they're actually fine in the middle of combat, and they're
Mhm.
perfectly fine
Mm.
around bombs and bazookas blasting. But what happens to them is when they come back home, they go into extreme bouts of depression, which I have never, I mean, I can't even fathom that. I can't even wrap my head around it. But then I started reading up on it, and so what they were missing is that sense of camaraderie which they had with, I guess, with their platoon or their entire command base, and they had a mission. And it's like, now you don't have a mission, life doesn't have a mission. So how does one and this will be my last question, I assure you, how does one actually develop that discipline of finding a mission in life? Because it sounds very easy, but I'll give you my example. I'll be very open about it. So I was an overweight, obese person, at least till the last 4 years of my life. If I remember, from the age of 21 till the age of, let's say, 35, I was obese. I was overweight. I had gone up to 96 kgs. And I clearly remember that one day in my life when I looked at the weighing scale and I saw myself at being 96 kgs in weight. I was like, that's it. This can't happen. I'm going down. And I started working hard. It was like I was a man on a mission. And today, in hindsight, when I have lost all that weight, have become fit. I mean, I couldn't play badminton. I was injured. I could not do any activity because what I enjoyed. And today, when I look at myself, I'm fit now. I can like run wherever I want to run. I can do basically pretty good, decent physical exercises which involve cardio, because my lung capacity has increased a lot. But what I realized was, it was that moment where my mind basically got a mission that, okay, this is enough. But where I see is, it doesn't work like that for everyone. Like for me, it was natural. I have to do it. I did it. But why doesn't it work for everyone else? What happens in our mental makeup that we're just not able to do it then?
I think you're talking about, people do know when they need to lose weight, and so on. But I don't know what that has to do with depression. I mean, it's not like if you had been depressed, then losing weight would have cured your depression. It's not like, I don't think it really uh, works like that. Although I'm sure, and this is something to remember, that this achievement that you've had of losing all this weight, I'm sure it's giving you a sense of achievement and what we call mastery. And that kind of gives people, I wouldn't quite say an inoculation, but if you achieve something like that, you feel you've done something, you've achieved something with your life. I don't really know how people can find a purpose for their lives. I think that's more a philosophy thing, or it depends on. I think in general, people have to think about what their own values are and what's more important to them. Like I suspect to you, for I'm sorry, for you, just from what you said, it was obviously important for you to be able to run around and play and be able to uh, get out there and do the things that you used to enjoy when you were thin. And for some people, it's going to be, and it might be something that has nothing to do with work. It might be that what gives your life focus is music, or what gives your life meaning is travel, which isn't happening anyway at the moment. But it's something that everybody has to work out for themselves. And people who don't, there, you talked about weight, and there are lots of reasons why people can lose weight and don't lose weight, and lose weight. But so that's a different issue there altogether. But if you talk about why do some people not even try, it might be that some people have decided already that it's a learned helplessness, and they think it won't work anyway. So what's the point of trying? Uh, they're not really. They give give up already before they try. But I think it might not be as important to everybody as it was to you. So I mean, it's a question of what's important to them. It was probably more important to you than it is to many people who don't even try. As I said, there are plenty of people who try and don't lose weight, and that's another issue altogether.
Fair enough. I think it also, I don't know how much of it has got to do with your inner genetic makeup. I'm not the expert. I'm not the scientist here, so I really don't know. But with me, I don't know what it is. I mean, I'm going to be very honest. I'm a very driven person. Like I need challenges in life, and that moment in my life I'll never forget. That scene is so etched into my memory. When I saw 96 kilos, I just wanted to take a hammer and smash that weighing scale in my brain. I did. And I was like, never again. This is not happening again in my life. I am not going to that 96 kg digital scale again in my life. It's not going to happen to me. And maybe it was my ego. I don't know what it was. I guess we all have an ego. I guess in my case, I had a bit more of an ego than needed, but I couldn't take it. I was like, in my head, it went, you piece of shit. How dare you? I channeled my inner Greta Thunberg, I guess. So I don't know what did I do there. But yeah, so I guess we'll wrap things up. Now, Nayanika, first of all, if somebody, look, I know it's very hard. So before I actually ask you this question, so let me. My whole aim of doing this podcast, first of all, I'm very sorry about the snag in the middle. I mean, it's sometimes, in life shit happens and my internet just
Yep.
gave up. So
Yep.
so first of all, very sorry about that, and sorry to everybody who's going to be who's watched this live. So sorry guys, it usually doesn't happen, but yeah, in 120 podcasts, if I have a mess up here and there, so I'm allowed that. But I wanted to do this discussion because I take depression and stuff like this very seriously. I have seen people in my own friend circle. I have seen people in my extended friend circle suffer from mild depression. So I take this stuff very seriously, and I hate it when our culture, when people just go around saying, "Arey, ye to pagal hai. Arey, ye to aisa hai. Arey, ye to aisa hai." No, 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 no. It's people are not mentally ill. People are not crazy. They are ill. Just like we have physically ill people, we have mentally ill people. So if you have words like that, I'm sorry to say, you're an ass. If you treat people like that, you're actually heartless. You're not that. So Nayanika, let's look. We live in the world of social media. So would if somebody was having some problems, and obviously, they can't talk about it in the open. Everybody cannot do that. So could they contact you on Twitter, and then you guys could take it offline? Could something of that? Would you be open to that?
Yes, I'd be open to that. I might not be able to help everybody, but I will be able to put you in touch with somebody who can help.
All right, cool, guys. Then I have added Nayanika's Twitter handle in the description of the podcast. So it doesn't matter if you're listening to this video on YouTube, watching this video on YouTube, or you're going to be listening to this on SoundCloud or Stitcher or whatever, or the audio format. Her Twitter handle is going to be in the description of the podcast. If you are one of them who maybe thinks they're depressed or is feeling down, or he needs or she needs, or whatever your gender is, needs some kind of help, some kind of guidance, don't be afraid to reach out. The biggest problem is the social stigma, and when people think that if I reach out about mental health issues, I'm some sort, especially with guys, men, speak up. You're
I
not a
really
worse.
want to. I really want to say this. I really want to say this as well. That and that suicide is the. I'm not entirely sure about India, but in developed countries, suicide is the biggest killer of young men aged 25 to 45, and I think it's absolutely tragic. So and I'd like to say to everybody there who's listening, and uh, if you think about suicide, stop, and you can't stop thinking about it, try and contact somebody and get help, and please don't act on it. There are actually people who care, whether you believe it or not, and there are people who will miss you.
I think we could not have ended the podcast on a better note. Nayanika, thank you very much for coming on the podcast. Finally, so we have a first time podcast of Nayanika, and it's an honor for me because I have so much respect for you that you did it. You did it at the Cārvāka podcast. So once again, thank you very much.
No, thank you. Thanks. Bye, everyone.
All right. All right, guys, you know the drill. If you like the podcast, please like, subscribe, share. You know the drill. If you want to support the podcast, you can become a member on YouTube. You can go on patreon.com/Cārvāka, and you can join the Cārvāka podcast Patreon club, where we discuss various books. I think this Sunday we're going to be discussing a paper. Last Sunday also we discussed the paper on the Saraswati River. And on that note, I'll take your leave. Namaste. Take care. Goodbye. See you next time.